Check your state and facility policy to make sure you are permitted to perform this procedure. Before you begin, perform hand hygiene and follow any other instructions provided in the preparation section of this program.
Good morning, Mrs. Lovely. I'm Stacy. I'll be taking care of you today.
To count a patient's respirations, first help her into a comfortable position. If not contraindicated, use a sitting or lying position with the head of the bed elevated to 45 to 60 degrees. After performing hand hygiene and ensuring privacy, make sure that the patient's chest is visible. Moving the bed linen or gown is needed.
Straighten your gown.
Place the patient's arm in a relaxed position across her abdomen or lower chest, as you would to take her pulse, or simply place your hand on her upper abdomen. To prevent the patient from changing her breathing, count respirations right after taking her pulse, while maintaining the same arm position, so the patient won't be aware that you are counting respirations and her breathing won't change. Watch for the chest to rise and fall. Once you can see the respirations consistently, look at your watch. When the second hand hits a number on the dial, or when the digital display hits a round number, start counting the respiratory rate, numbering the first cycle you see as 1. Count the number of respirations you see for 1 full minute. Or, if the respiratory rate is regular, and if permitted by facility policy, count the rate for 30 seconds and multiply by 2. The respiratory rate normally ranges from 12 to 20 breaths per minute. For respirations that are irregular, or less than 12 or more than 20 breaths per minute, always count the respirations for a full 60 seconds. As you count the rate, note the depth of the respirations by observing chest wall movement. Describe the depth as shallow, normal, or deep. Also note the respiratory rhythm, which should be regular and uninterrupted, except for an occasional sigh. Ask about and observe for any difficulty breathing. Replace the patient's bed linen. As part of your follow-up, document the patient's respiratory rate and pattern according to facility policy. Report any difficulty breathing to the charge nurse. Perform hand hygiene and report completion of the procedure and your observations to the charge nurse. See the follow-up section of this program for detailed information.